afternoon, everybody. I welcome you now again in Plenary 5. Well, at the opening, I said there are 3 special reasons which makes this conference special, and the third one was that it's the 20th HPH conference, and 20th is a round figure, and therefore usually we think something like that could be a jubilee, and jubilees are a reason to celebrate, and we had perfect possibilities to celebrate at the excellent social events we have been invited here. But usually a jubilee is a reason too for some kind of reflection. And now we will have 60 minutes to do this reflection. You will ask me why I have been chosen to be the chair of this session. I think I fulfill one criterion, and the criterion is I have attended all the 20 conferences. Is there anybody in the room who has been to all 20 conferences too? And great! Congratulations, Anne. Shall I hand the chair over to you now?
No, thank you. You were the father.
Okay, thank you. Yeah, what we will do is the following. Here you see a slide which says in what kind of phases we have developed. There was a first phase. It was even before the Budapest conference. When we started via feasibility study in 1988. We started a WHO model project in 1989. We started the network officially by WHO in 1990. We had business meeting. We developed our first policy document, the Budapest Declaration, in 1999. Then in 1992, we had business meetings to find the 20 hospitals which were taking part in the European Pilot Hospital project. And in 1993, we officially started this project, and we started to have not business meetings, but international conferences, and we started to have a newsletter as well. Then in the next phase, we did testing the concept in this European Pilot Hospital project, and we started to have an official policy by WHO to form networks. And for the European Pilot Hospital projects, it had been one criterion: they had to be prepared after the close of the project to start a national or regional network. Yes, and we did it in that phase. In the next phase, we were spreading more and more regional national networks, and we started to have first task forces, so some kind of inner differentiation was done. Then we had a very important phase starting in 2001. WHO at that time decided that we have to become a little bit more formalized, so we developed standards. 2 working groups did that. We developed strategies and standards at that time, and linked the concept to quality, and still quality is a very important companion for us in hospitals and healthcare. Well, and in the last phase, we started to restructure again. First, we became independent, became an autonomous association by Swiss law, but one which has a memorandum of understanding with WHO. And we changed our focus. We started to be not just a network of hospitals, but a network of hospitals and health services. And very important too, and the first network outside Europe we had in 2005, we started to globalize and become international, and that was part of our constitution. So that was the way we went. Yeah, and we thought for doing this reflection it would be good to invite some of the people who have been leaders in that time. Of course, there were many more leaders. We have now leaders here from 3 continents, and you see Gender mainstreaming is done very well at this panel. And we have people coming from different professions. We have medical people, public health people, psychologists, and other people. Yeah, here you see a little bit of these people, but of course, so much more could be said. It's just a first kind of information, and if people like to say more about themselves, they will have a chance to do that, of course. Yeah, that is the panel, and I won't say more about the panel in a moment. The interesting thing is what is our task here. You see, it's about 20 years of reorienting health service towards health promotions, achievements and outlooks. If I make the question more, if I radicalize the question, I would ask, have we really reoriented health services? Have we really developed health promoting hospitals? Or have we just done health promotion in and by hospitals? And I think that is a real critical question we have to answer. How far are we on this way from health promotion in hospitals to reorienting health services? And of course, it's a long way to Tipperary, as we know. So, and then there can be some more concrete questions. One, what did we achieve? What did we learn? What should we keep in the next 2 decades? What should we leave behind? What do we have to change? And where do we want to go in the future? And I will start to ask, and people here have now the choice which kind of questions they want to focus on. Maybe it would be good to start with achievements in the past and then go in a second round to the future. I would like to ask Margareta. Why would I like to ask Margareta? Because she has been with the network for quite some time. Linköping, the hospital where she is working, was one of the European pilot hospital projects. So Margareta, why did you become a health promoting hospitals? Why do you still stay there? What is your experience about the achievements and what did we learn?
Thank you, Jürgen. I have been thinking why we became a health promoting hospital in Linköping. I remember quite well of that. The idea came to Linköping by Professor Johannes Wang, who also was one of the founders, and he was in Linköping working, and he presented the idea for the hospital director of the university hospital in Linköping. And sometimes we used to say that the idea has sort of, say, 2 sides of the coin, where one side of the coin is the way we as health services can promote public health outside. And while this officer was very keen on public health issues, he would never have taken this on if he had not seen the other side of the coin, which means that the health orientation was for him a way to make a more professional and more effective use of his management of the university hospital. And this was his and our vision. And what has happened during the time is that this vision really holds. The longer I work, the more convinced I am. And in parallel, we have gone and must continue to go from visionaries to professional, evidence-based development people who really integrate this into the ordinary development work of the hospital or in the settings. But still, I found myself writing, but we mustn't forget the vision. We cannot only be burning hearts, but we shall not be cool. We shall remember the heart, but professionalize it. And one thing which has happened over the time is that actually research has sort of hung up to us. So many of these visions were not evidence-based, but now when we test them, we can show and see that they have evidence.
Thank you, Margareta, for this start. Well, in a way, the next could be Klaus Diethard, but he will not because he started very early. I think I now rather would like to ask somebody who has not such a clear line of affiliation to the network. I would like to ask Sally, who in the 90s already had contacts to us, and much later started a network in Australia and became a coordinator. Sally, what made you collaborate with us and accompany the network for such a long time? And what kinds of achievements do you see?
I came into the network, well, I really needed the network because I was working at that stage in early 1990s as a hospital-based practitioner, and was a fairly rare creature in a way, because there were very few people with that kind of responsibility to try and influence the profile of work within an organisation that was something other than strengthening medical care. So I was always looking outside my own organisation for people and inspirations that would enable me to learn about how to do this work effectively. So I attended the first HPH conference in Warsaw, I think it was, and found a new family of people who carried the same vision that Margaret is talking about, but more than that, were very driven to see the practical opportunities and solutions to be able to bring about not only organisational change, but systems change. Because of course, unless the hospital reforms are supported by system reforms, they're not going to be sustainable. So I think the new family I found really offered a lot of contacts, but from many different angles. And over that time, I think one of the great successes of the network has been really to let 1,000 flowers bloom. You know, we only have to look at the program of each year and see so many different ideas and experiments in many ways being reflected. And I think part of the strength of the network has always been openness to different ways of understanding what our policy problem is that we're trying to solve and what kind of solutions we can bring about.
Thank you so much, Sally. Well, the lady sitting on this side of me is very much at the center of the network now and came in a very important phase and had real influence of changing the network. Hanne, how would you talk about your start? What brought you into that? And what do you think have you achieved in this first phase when you came to this network?
Thank you. This is really hard questions to answer. Actually, I am just a surgeon, a traditionally trained surgeon, doing a lot of research, focusing on patient safety, patient outcomes for many, many years. And back in 1998, I had some kind of a wake-up call, if you can say that. Some hospital managers took contact to me and asked me if I would like to be the head of a very new department established by the Ministry of Health in Denmark, having a national function, working internationally with the network as well. And they handed over a little more than 3 million euros. And I was very young at that time, and I did not have much experience outside the surgical world. But that was a start, and that was also a challenge and a temptation for me. So that was the way it began for me in Denmark. Almost over the night, during a few months at least, we built up a very, very strong Danish network with almost all the hospitals in the country, working very proactively, working patient-centered and evidence-based from the start. We developed a lot of pre-tools, if you can say that. The standards we now use in WHO is primarily developed, or the draft is made in Denmark and tested there. The two other tools, the HPH model for documentation and data model. It's really fascinating. Was also primarily drafted in our network. And this was a very lively period. What happened then was, and that is really some hard lessons to learn. We had an election and a new government, and they changed everything almost also overnight. So the Danish network closed down from being a very, very strong network to being only a few individual members. Now we have a new government, so we are working very hard to have it re-established. But just to tell you that some of the lessons learned here was that even though you managed to do a lot of work, you managed to implement it, you really think that, oh, now we are almost at the end of the process. Then there's also a maintenance period, and that is as important as the implementation part. So we have learned some hard lessons here.
Thank you so much for sharing these lessons with us here. We can learn from these lessons. Yes, now I would like to ask Diane. Why? Diane has been affiliated to the network for quite some time. I think Bratislava was the first conference where you were. And you always have been to many conferences and given presentations. And the interesting thing is that you try to develop an Israel network. Hopefully you will succeed soon. But nevertheless, all the time being outside the network, you have been in a very important institution which does health promotion in quite an impressive way. Can you tell us why it's important for you to be affiliated to this kind of network while you are doing so much already in Kladit?
Thanks, Jürgen. It's a very interesting question. I have been affiliated and very excited about HPH for almost 20 years. And I think one of the reasons, personally and on a professional level, is that for all of you who are working in health promotion, I think you know that there is a question about to what extent health services are part of the whole health promotion mosaic. And when we look at Ottawa, the Ottawa Charter, we have reoriented health services. But I think some of the discussion that's going on internationally about health promotion is what we say maybe in Hebrew, I'll translate, you raise an eyebrow about health services. How much health promotion really should be in health services, and how much health services can be effective. And I think the wonderful and the best answer is the concept that is being promoted by HPH, because I think this is the way it has to happen, and I think this is one reason why I'm so attracted to the whole network. And I'm trying to bring both my institution and other institutions in Israel into the network, because if health services are going to play an important part in health promotion, I think the concept of HPH and the standards and all the background material and all the wonderful work that I'm just so enthused about hearing that's been done in the past couple of days. Every time I come to a conference, I come back very inspired, and I think you should all be very proud of what you've been presenting and the discussions, because for someone like me, I leave here with a lot more inspiration and a lot more enthusiasm, and I hope you have as well. But I think one of the things I encounter daily working in health promotion and being the director of the Department of Health Education and Promotion for the second largest non-governmental organization in the world is that actually we're being asked questions that maybe are opposite of what you're being asked. I've been asked often, we're doing so much health promotion, why do we have to be recognized as a health promoting hospital? So this is kind of a sarcastic question, but my answer is, and I hope it's yours as well, and I of course would like to be enriched by other answers, and I think it's about quality and it's about commitment. I think we're all doing, and a lot of institutions are doing a lot of activity in health promotion, but I think that when we talk about commitment, commitment means policy, commitment means the maintenance and the long term, which was you mentioned as well, and making sure we're doing it as best as we can. So I think that is part of our answer. I think that also the HPH helps us keep it on the public agenda and keeps us doing the directorship or the managing job a better job. Again, instead of just doing a lot of activity, how are we managing it? How are we making sure that it stays on the public agenda? And the advocacy that can be done through HPH is extremely important as well. And I think for me, one of the most important parts of it is sharing successes, dilemmas, sharing challenges, sharing issues, struggles, and I assume that we all sense them in one sense or the other in our work, and I think this is a wonderful platform for doing it. I feel sometimes uncomfortable about the work we're doing that we're not sharing, whether it's in multicultural health promotion, whether it's continuity of care, because our institution is very unique in that under one umbrella we have 1,300 community care clinics and also 14 hospitals, and we have a continuity of care as part of our strategy, and it's unique, and I would love to be sharing it. I would love to share more about what we're doing with health literacy. I would like to share more about the research and our evaluation, and I would like to get response. I would like to get more reactions. I would get feedback. What should we be doing more or differently than what we're doing? And I think the HPH is just a wonderful platform for doing it. We're a very small country, and we unfortunately have very few people working in health promotion. I'm so envious of Taiwan and how many health promoters you have, and this is my opportunity again to thank you so much for all you've done. And we don't have that opportunity in a country like Israel to network as much. So when we come to conferences and when we work together, either virtually, by email, through video conferences, corresponding, publishing, and of course meeting and discussing formally and informally at conferences like this, we profit from it. And I think that's one reason why it's like a magnet for me. I keep coming back, and I really want to pull in so many more of my colleagues from Israel. And hopefully we'll be a new network as soon as possible. And this is my opportunity just to say that I hope to see you soon, all of you in Israel. Hopefully in the coming years we'll be able to host one of the HPH meetings.
Thank you, Diane. Mazel tov for the Israeli network.
We'll let you all know when it happens. You'll let us know when we're okay. Thank you.
Well, compared to the other people sitting here, you are a latecomer, Shuti, but a very quick starter. Why did you come, and how did you manage to start so quickly?
Yeah, I think Taiwan joined this big family really at the perfect time. It's during the 5th phase when the standards were published. Yeah, and so we got you have invented the very good will, and we joined to use it to write us. So we joined at the right time. But I think in Taiwan, actually, like Diane said, we did health promotion in our hospitals. That's a history, because in Taiwan, our hospitals can provide direct services, outpatient service, anything to patients. So there's a history of doing health promotion in or by hospitals. And in the year of 2002, when Taipei City, we launched a Healthy City initiative. We also include healthcare setting as a partner to do the obesity control program. However, before we joined this network, mostly we are doing health promotion activities in or by hospital. And for the Healthy City project, we had the health promotion program in hospital and by hospital. But still, that's not something equal to being a health promoting hospital, a health promoting organization. That's the difference. And so when I invited my colleagues to join, and we seriously look at the standards and self-assessment tool, we have the mixed feeling. One thing is that, we are not doing too badly. There are a lot of things we're already doing, so we are happy. But at the same time, we also found many things that we haven't done. For example, it said that health promotion should be built into the clinical pathway. In the past, we did not do that. So we found many challenging things, and we also found that we did not do a lot of staff health promotion. So we were very happy that the standards and the self-assessment tool did guide us to transform ourselves to be a health promoting organization and a healthier organization also for our staff, for patients and also for our staff. So we are happy we came at the right time. Yeah.
Thank you so much, Shruti, and especially for showing us how well these tools can be implemented. If there is somebody behind like you in the country which puts real priority to that, what can be done in a very short time. Congratulations.
Do you allow me to say a little bit more?
Maybe later?
Oh, okay. Yeah.
Maybe later? Well, Klausina, you are with the network for a very long time, so you could have started, but you preferred to be in the first round, the last speaker.
Yes.
Why did you prefer that?
Yes, thank you very much. Cut it short, only Klaus, not last teacher. Yes, where do we come from and where we are going? I still hold a great fascination for the HPH philosophy. During more than 20 years, I walked through 3 phases of fascination. Phase 1 started with the pilot project. For me, as a clinician, a professor in cardiology for internal medicine, I had felt sadness because modern medicine lost its philosophical and ethical roots. The old Greek doctors had been physicians and philosophers. They were advisors and consultants for prudent living, and prudent living is healthy living. For me, HPH became a revival of the ancient holistic medical view, and it goes beyond. The old thinking was patient-centered. HPH thinking is also patient-centered, and it goes beyond. It is also staff-centered, and it also environment-centered. And that tells the difference between health promotion and preventive and rehabilitative medicine. Health promotion goes beyond. Phase 2, that's the phase when we set up our national network. Wow. We were so enthusiastic. In the first 2 years, we had 35 hospitals join our network. In the following years, speed slowed down, but after 10 years, we had the maximum 73 hospitals. In the following years, some hospitals terminated the HPH membership, about 20% of the hospitals. The reasons are economical and concentration on core medical duties, and from the administrators and managers' view, HPH brings no economical gain. So those people are not, have no thing before health gain. That's bad news, but there's also good news. Those hospitals, which still are members of our network, for them, the membership is a matter of the heart. So in the last 2 years, we had wonderful national conferences. We had more hospitals. We had revived 3 hospitals. We got new hospitals, and we had 1 membership from a bigger health service organization. What we have learned from phase 2 is never give up, trust more in the heart than in the brain, and stay enthusiastic. HPH without enthusiasm is old hat. Phase 3, that's my phase 3. It has begun in the last 3 years, and it is a phase of reflection. What are the fundamentals, the basics, and the mission of health promotion? And I agree with what yesterday evening my colleague of the World Medical Association said, but I have another rating. He put science first, but I put ethics first. And as a medical doctor, health, I think, is shorthand for ethics. And Second is science, and then is trust. Trust in health promoters and good communication. And if you like to call all that together, you can call that love. And today, I want to thank to the parents. And these parents are two persons. The one is a female, and then this Dr. Ilona Kickbusch. And she was the director of the Department of Health Promotion by WHO for health promotion lifestyle. And she's now a professor in Switzerland. And we have a father. He is a father, everybody knows, Jürgen Pelikan. Without our parents, we could not be HPH children. And we have a midwife. No, yes, without midwife, we have the children. And I have now a closing remark. You all see a new spring, a new HPH spring here. A new generation is growing up. And the representative of this new spring and this new generation, I think it is a lovely, it's a wonderful flower. I wrote a wonderful power, but let's suppose a wonderful flower. And this metaphor is called Choo Choo Tea. Thank you very much.
Thank you so much. I hope phase 3 will be long for you, or that there should be a phase 4 for you with health promoting hospitals. Now you got some impression of these people sitting here, but now I would like to give the mic to Anne Reardon. And you have observed this network and these conferences for a very long time in very different important positions. Looking back, what would you say did we achieve? And I hope I will get out of you some more critical remarks than I got from these people, because I think for the future we have to see too what did we not achieve and what do we have to change. And I would like you to start this round. Is that okay for you? Can we have a mic?
Thank you. It was unexpected, but thank you. Yes, I think Professor Hullerman mentioned family, and we've heard family in lots of places. I think I grew up in the family, and I think, yes, I think when I stepped down from the governance board in Berlin, I said I had graduated, that I had started. And I have to say, this is, for Ireland, I came in with really I would have said, I did health promotion in hospital as a clinician, but I didn't really have an idea of health promotion in the broad sense. So I learned a lot about that. I also learned around the challenges of trying to implement it in an organizational structure. And I think that's still an ongoing structure. I don't think, well, from my perspective, I think we've done a lot, but I don't think we've really delivered on the reorienting of the health services yet. We've done certain parts, but I think we've still a long way to go.
Have you any suggestions what we have to change to get better on the reorienting part?
I think one of the things which we are starting to do, and I think it is that integrating it into the clinical pathway. I think this is really the key bit. But I think we also need to get it at the political level in terms of strategy, in terms for health service delivery. But I think there are other opportunities maybe with our universities and the educators of our clinicians for the future around that philosophy, and that they become advocates at the national political level for that change to happen. Because I think you need champions on that. Thank you.
Thank you so much. You have been one of the champions. Louis, I don't want to get up again, therefore I asked you just now. You have been so important too in the last phase. What
would you say from an American perspective, because we have no American perspective?
European, Asia and Middle East. But we came in, you know, at the fifth phase in 2005, and it was because we have gone through a very historical reorganization of our system here in my country, and we have decided to create health services integrated by merging hospital, primary care settings, long-term care centers, rehabilitation center, and to create a new concept of health and social services center in my country. And when we start to do it, we have held public meeting, you know, with the citizens in our country, and people were coming to the microphone and were saying, "You are mad to merge primary care and hospitals, because you will kill what we have done over the 20 last years to develop health promotion in our system, because we were active in healthy cities since the beginning and also healthy schools." And they were saying, the new organization, they will just take care of doctors, they will take care of emergency rooms, they will take care of operating rooms, and you will forget health promotion and prevention. And we went on the web, you know, because I was in charge of this strategy, and I just go and put health promotion in hospital, and I have found the network here in Europe, and I have read all the stuff and go back to the Ottawa Charter that was signed in my country, but not produced in my country. And really, at the moment, it was a key moment for us, because we decided to become member of the HPH, to vaccinate, I would say, our new organization against the risk that I was talking about, and to give the administrator and the new director general of this new institution a tool to make sure that the hospital will be a partner and a key partner in health promotion and not an enemy. And we succeeded to do it. You know, it was accepted as a recommendation. And I remember I went to Moscow to attend the conference at the time. And I have a bet with the director of public health. He said, "You will not succeed to do it." I said, "Yes, I will succeed. They will pay my trip to Moscow." And I went, and he paid my trip to Moscow. And after that, just quickly, we organized a launch conference in Montreal to launch it, and we have invited at the time Dr. Tornason, because I have noticed her booth at the Moscow conference. It was one of the most interesting one, and I remember we have invited Dr. Jorgensen, because it was the time where you have produced the standards, and the standard was a key element for us, you know, because the concept was very clear with the standards, you know, take care of the staff, the community, the family, the patient, and it was a key point, you know, and we were able to connect it with quality management. We were able to connect it with the management of the workforce, with the community, because we were active in the healthy school, healthy cities. So it was a key point, and like Shuti said, that was a real good moment to come in because of these standards, I would say. And we benefited also for the help for the elder ones, you know. And I appreciate the help of Hannah, Jürgen, the two collaborative centers. Without them, we were not able to succeed. Our colleagues of other networks that were there before us, and also our predecessor. You know, I think it's important in an organization like this to remember that we were preceded by others, you know, like Anno Riordan, she was the first chair. Yanis Tutas isn't here, but he was a very important contributor and a model for me. Shuti was a very good partner, and she was one of the greatest chair in our organization. One thing I want to say for the future, you know, if I may, I think it's very important now to create partnership at the international level with organizations and can help us to implement the concept in field where we do not have their resources. For example, if we want to introduce health promotion in every pathways, we have to think about obstetric, we have to think about oncology, we have to think about a lot of things. And if we partner with Baby Friendly, it will help us. and it can be integrated in HPH. We can partner with age-friendly hospital, and it fit in the HPH. What is beautiful with HPH, we can do this partnership and use HPH as an integrator, because we have a small organization at the Secretariat, and these organizations have resources that can help us, and it fit in our concept, like Green Hospitals. As another example, the International Labour Organization can help us also because they have resources that we do not have. And I think it's a key point for the future to invest in this, and also in research. And research to prove that what we say, that's true, that is effective. Thank you.
Thank you so much, Louis. Thank you for coming in the right moment and for starting now to talk about the future, what we shall do. I think it was very interesting to look back and get these different perspectives. You see, because the most interesting thing for me was health promotion is a universal and very flexible concept, but it had to prove its value under very different circumstances. And I think that for me was very interesting in how very different circumstances you could take up health promotion and use it to go further. Now, again, the panel has the word, and I think we have not too much time left. Therefore, I would like all of you to give a short vision or a short proposal. What, from your perspective, would be the 2 or 3 most important things we should do in the next decade? May I start again with you, Margareta?
Maybe to be provocative, I sometimes think to go from health promotion in hospitals to health promoting hospitals, I sometimes would want to use the reorientation thing and talk about health-oriented health services, because that makes it very clear that it is about the whole service, and it's the synergy between people who do health promotion in primary care, hospitals, etc., that we together, the focus is on health. And so I think we need to be much more integrated. We must keep all the different lines together and show very clearly that all these are working in synergy with the same aim to reach a better health gain for personnel and patients.
Thank you, Margareta. Diane, what is your advice to the network? What do you think we have to do most in the next years?
Well, thank you. First, I also want to thank you for allowing me, for inviting me to participate in this panel. This is very special, and to express my ideas. I think if what we've been seeing is in the past few years is going to continue, I think the issue of the economic recession is going to stay with us for a while. At least if what's going on in Europe is going to be a reflection of the coming years, and perhaps other parts of the world. I think HPA should think about how we can be part of the solution. Just participating in some of the meetings in Europe and around the other parts of the world, it seems like the healthcare sector will be suffering. It won't be automatically saved with economic recession. So I think if we can demonstrate how it's the right thing to do, it's the smartest, it's the most economical thing to do, is to invest in HPH, I think we can get a lot more attention, a lot more leverage, and do a better job. For example, if there's been a price tag put on the issue of health literacy, it's been measured in the United States and parts of Europe that we are losing money, and there's a lot of money wasted if we don't organize our health system and we don't implement the principles of health literacy. Billions of dollars, at least in the States, have been shown to be wasted because we're having, there's duplication, there's mistakes, there's examinations that have to be repeated and all because people aren't understanding the messages and we're not applying and we're not navigating the system well enough. So if we can think of those ways in which we can promote health and use the right strategies, I think we can get more attention also when politicians are looking for ways to save money, particularly during the economic recession. that is one part. The other part, I think, is the area of social responsibility. It could be that I haven't been listening closely enough, and I apologize. I think I would like to hear more about the issues of social values and social responsibilities in HPH. We're talking about patient-centered care, maybe family-centered, and I think we also have to talk the language of social responsibility. I think it speaks to many of the managers, again, the politicians. We have just begun the past 2 years social responsibility for Ethiopian health and other issues that were brought from our CEO, from our Director General, and it of course speaks to health promotion, and I think when we can speak that language as well, it thinks it fits the values of health promoting hospitals and health services, and I think it would get much more attention. And I also think that, again, perhaps I wasn't listening closely enough, but I would like to hear more about how health promoting hospitals and health services are using the media to bring the messages across. First, for more visibility about what's being done, and also to bring health messages that will serve and benefit the public through the media, so that they will be using the services better, know what to expect, know what to ask for, and perhaps even be healthier when they do need the health services. So I think this, along with more training and basic training of the health professions, and also continuing training on health promotion, I think this would be a lot to do for the next decade. And I would
Thank you. It really is a lot what you give us, but we should try to.
And just if I may, if we talked about the economic recession, I'd just like to remind you all, if you haven't heard, that it will be one of the themes of the European Health Promotion Conference of the IUHPE that will take place at the end of September, 27th to 29th of September. So if any of you would like to participate, go on the IUHPE website, www.iuhpe.com, if you have information, and the discussion will continue there. So thank you very much.
Thank you. Klaus-Dieter, any concrete things after your very interesting...
I think it is a challenge to have more physicians, more medical doctors in the boat. And there's a different language, and how you can do this. Perhaps if congresses like this one, you have workshops, and it's presented how you do health promotion in the clinical setting, how you do this. And I hope that those who are very familiar with the health promotion field present papers in scientific medical journals and go to the congresses of cardiology and oncology and so on. Thank you.
So we need ambassadors like you for the clinical field. Yeah?
Yes.
Thank you, Klaus-Dieter. Sally, what is your advice for the future?
One of the things that's been on my mind through this conference is the opportunity for the governance board to work with members to develop a research agenda. I don't think there's one in place, but I think that, as I mentioned before, we've seen so much fabulous research presented in posters as well as workshops and plenaries, and for me I'd like to make sense of what all that means in perhaps a more systematic way. Not quite sure, but I think it would be a great opportunity for the governance board to connect with members around something very tangible that would also be a sort of a driver of some of the priority areas where research has been neglected, or where we do need to be doing much more research. And that may be research around health systems, around leadership and governance, as well as health promotion strategies. So there's quite a range of areas of research that are feasible. I think we need to get a little bit more radical. I'd really like to see us harness some of the other social movements a little bit more, human rights, consumer empowerment, and bring in, which demands that we bring in a wider range or a different range of partners, and perhaps look at how we work
with those partners as well, because we are trying to challenge the massive investment in health systems that we've made over the last 30, 40 years that have perhaps weakened the potential for those systems to promote health. So we need to think about perhaps who else we can partner with to drive change at different levels. And the third thing I'd like to see is, and it's certainly evident in this conference, is active globalisation of the network. I think I do quite a lot of work in the Western Pacific region where we do leadership development, and the convening power of an organisation like this to bring together people who have got experience in many different areas and create that sort of learning tension for everyone, so we can share ideas and experience, but also get pushed in the way we understand health promotion in the kind of areas that we decide to work on and so on. And I think that would, that globalisation of the HPH movement, which has already begun, can only be good for all of us in how we think about health promotion and what's possible.
Thank you so much, Sally. Hanne, much responsibility on your shoulders. How will you use it, and what do you think? What do you prefer? Where to go and how to go there?
Actually, I have two scenarios for the future. One is that health promotion takes place all over the society. Families, institutions, schools, cities, communities, workplaces, everywhere. So no health promotion would be necessary in hospitals and health services. That means that the HPH network can close down. We can spend our time and resources on something else. But then I realized that this is probably just a dream. It's a good dream. I hope that in 20 years I will be able to stand up here and say, I had a dream 20 years ago. But the more realistic scenario, as I see it, is that we have to work hard. We don't need to be stressed or overworked, but we have to be focused upon, stay focused upon our main goal, which is a better health game aimed at patients, staff, and community. And in the same time, we also have to be able to act and accept the changing world around us. This is not one fits all, or this is done forever. We really have to be able to act in the world, not only the clinical world, but the whole world change, and we have to change with that. So I think that is really something where we have to focus upon. And the way to do that, the good advice I have is to act on several crossing lines. I hope the lines will cross at the same time. The strategic and political level and the practical level. And the strategic level and political level is to take leadership, set norms and standards for health promotion in health services and hospitals, and also to establish maybe not many, but a few very, very important strategic partners. To establish these partnerships that would help us very much in the future, but only with partners working towards better health gain for patients, staff, and community. At the practical level, we need to continue working, to continue to work evidence-based. That involves, of course, the evidence, the staff competences, and therefore, as has been said already, education, teaching, and training is so important, and that is also why we established this new master of clinical health promotion, bridging between the community and the clinical world. We have to do that, definitely. We can only do this by working together, by creating synergy, by building upon each other's experience and knowledge. So in the future, collaboration, collaboration, collaboration.
Thank you, Hanne. Well, Shuti, you got a good baseball. What will you do with the baseball? In what direction will you throw it and how far?
Wow. Yeah, that's indeed something we are going to work together with the governance board, the secretariat, the two collaborating centers, and all of you, but we need more to work with us also. Yeah, that is also what I would like to say, that health promotion is the right thing to do. However, our clinicians are already having tremendous workload, so we need to support our frontline people to do things smarter and easier. That is why we need to implement, to transform to HPH so that we can get the organizational support for staff. But at the same time, I think as the other panelists have mentioned, we also need to strategically building up the partnership with at the national level and at the global level to get support from policymakers to support organizations and clinicians to do health promotion easier and smarter. I think that strategic partnership building will be very, very important. But at the same time, quite often people will ask us, what are your evidence to say that HPH or HP is the right thing to do? So I think our conference, with the participation of all of you, with so many very good scientific abstracts and papers, that's very good. But you need to also work a little bit harder to turn your abstract into articles and make them published. So together we have evidence, we have love, and we have collaboration, collaboration, collaboration. We work together. We will have a very bright future. Thank you.
Thank you so much, Shruti. Well, I have to excuse myself to the audience that all 60 minutes were used up here, but I think listening to that, I hope most of the things which are going through your brains have been mentioned here, and I hope there will be a possibility on the website in the future that you get a chance to complement what was said here. But my main impression is that a network which has this kind of leaders and champions, we don't have to worry about the future. I think there will be a good future as long as we have people enthusiastic and smart and intelligent and engaged as these, and many of these, I hope, are sitting there, so we will have a good future. I wish the best for the future of this network, and thank you so much for your attention in this plenary. Thank you.
Don't forget the visual. Yes, same one. And you have to go first. So, everything okay? Thank you so much.
Okay, 1, 2, 3, cheers.